Whether you're laying on the beach or laying on a tanning bed, you're exposing yourself to harmful ultraviolet rays, which can lead to melanoma, also known as skin cancer.
And so what we know is that sun damage happens when you are 2, when you're 3, when you're 4, when you get the sunburns as kids, when you're running around the farm or the pool or wherever you are, the neighborhood. Once you have that sun damage, it doesn't ever go away. And so the more burns that you have as a child, the more burns you have as a young adult, the more times you go on spring break and not wear sunscreen and get burned, the more likely you are to have melanoma.
Carey is in treatment right now for melanoma. Last year, she noticed an irregular mole. It wasn't until 6 months after her initial visit that the decision was made to remove it, and she got the unnerving diagnosis.
She just said, I'm sorry to let you know that you have melanoma and it's stage 3, and then she started crying.
Carey's exposure to UV rays came from decades of laying on a tanning bed since she was 14.
I used to do it every day for 30 days, and then I'd do it every 2 days.
Now Carey is in a fight to beat the disease. She turned to Franciscan St. Francis Health for treatment.
I had to go get a biopsy done, and then I had to go get the surgery done to get lymph nodes removed because I had 3 positive lymph nodes, and 4 chemo treatments every 3 weeks, and now I have to do it every 3 months for the next 2 years.
Our eyes are our best friend, and we need to pay attention to everything on our body, whether it's a mole or spots that we can't see. We need to have our family help us do monthly visual checks.
Here are now the ABCs when it comes to checking yourself. Asymmetry. Does half the mole look different than the other half? Border. Are there irregularities or uneven edges on the mole? Color. Is the color uneven or multiple colors involved? Diameter. Is the size greater than 6 millimeters, which is about the size of a pencil eraser? Evolving. Is the mole changing?
A change in a mole, a change in a freckle, sometimes bleeding, itching. And a mole that itches is sometimes the first thing that patients will see, and then at that point we recommend that they see their primary care doctor or their dermatologist and say, hey, let's take a look at this.
Dr. Meyer tells us caught early, melanoma is curable. Sunscreen with an SPF of 30 or greater is key, reapplied every 90 minutes, even on overcast or cloudy days. For more information, go to indieboomer.com. Jason Heath, Boomer TV.